Thank you, and welcome all that are back behind the camera here for joining us for this museum midday. And this is our first in-person museum midday of the season. Right. So we're glad and happy to welcome Alma Manabat Parker, who's worn so many hats over the year. We're trying to figure out, you've probably seen her through many of her different positions on various boards and nonprofits throughout the community, or when she's taught dance and any other number of things. But today she'll be sharing a little bit more about the Ketchikan Wellness Coalition's programs, and specifically the Healthier Together program. If you were lucky enough and privileged enough to attend this last weekend's second annual Fil-Am festival, if you enjoyed it as much as the rest of us did, you'll be delighted to know that this is a program that is more than just one event every year. It's something that's year-round, and Alma's going to share a little bit about that and kind of how that intersects with culture and community here and health equity. So again, thank you.
Thank you. Thank you so much. Thank you so much. Thank you.
Yes.
Okay. Yes. Well, again, my name is Alma Manabat Parker. I'm not sure where I'm supposed to be looking. The camera or wherever? Okay. I'm here as the Health Equity Program Coordinator for the Sama-Sama Tayo sa Kalusugan project, which means Healthier Together. It is a project, definitely a passion project for me, that really focuses on improving health care and health access of Filipinos in the community. Here's the most recent photo we have. This is taken right at our Fil-Am Fest. Some of the volunteers here, actually all of them work with Peace Health, which is a major partner in this project. I really like this quote. I like to open this presentation with, there are only 2 days in the year that nothing can be done. One is called yesterday and the other is called tomorrow. So today is the right day to love, believe, do, and mostly live. And that is what I feel that is like the driving force of this project, is we do what we can today. What we did yesterday is, you know, our past, and we just are mostly trying to figure out how we're just gonna go through the day, make it happen, make it better for people in our community. And I've been sharing this quote and people have been taking it and borrowing it, and I'm like, it's not mine, it's the Dalai Lama's. So you can share as much as you'd want. Many people are asking, well, why is there such a focus on Filipinos and Filipinos in Ketchikan, and why is this project even existing? Well, as many of you know, especially those in the audience, we have a historian in our audience. Filipinos have strong ties and long history here. And just a brief recap, I mean, with the US colonization, Filipinos were able to come to the United States more freely in the early 1900s, and they came to work in the fishing, whaling, and gold mining industries. The term alasqueros was developed to describe Filipino cannery workers. Many of the workers came, they were mostly male, and they came to work specifically in the fisheries and the canneries. And here at Ketchikan, Ward Cove Packing was one of the companies that really had many alasqueros. Ketchikan is known for the first Filipino community club in the entire state of Alaska. So having that shows that there is something about connecting community, especially our Filipinos, to where they live and how we find a place to gather and how we can connect with each other, find similar stories, that the purpose of why we're even here in Ketchikan. Could you imagine immigrating in the early 1900s, leaving your family behind and not really knowing where you're going, what you're about to do? So having a Filipino community club, it was really meant for an opportunity to not just gather, but to bring folks their concerns to the forefront. They had opportunities to invite delegates. That picture at the very top, there are some consulate members there that they invited to just share about their culture, but also to talk about concerns amongst their community members. In the state of Alaska, Filipinos are the largest Asian American subgroup. So the presence is here, and this is an opportunity to not only show that, but also elevate the voices, because there are many of us here. And in Ketchikan alone, there are 10% of our population approximately are Filipino or have Filipino descent. The picture of the nurses, you will see maybe a familiar face there. Grandma Clara Diaz came as a nurse, and she is there in the lower picture. The cabinums, I believe, are the ones doing the clamming on the side there, and up right in the corner are some of the Filipino cannery workers from Ward Cove Packing. So the grant that we got was from the Community Solutions for Health Equity, CSHE, and they awarded the Ketchikan Wellness Coalition $300,000 for a 3-year project. And the CSHE grant program really looks at elevating voices for the communities of color and communities that are left out of discussions when local healthcare systems in the U.S. are creating policy. That is a big endeavor to take on, but the capacity that we have here in Ketchikan is to look at health systems locally, and that is why we really partnered with Peace Health as the main healthcare provider in town, and they have really stepped up to the plate to figure out how that health system can address some of the barriers and challenges that people of color experience. We got the grant. We were one of 1,000 grant applications that were submitted, and we were one of 11 that were actually awarded, and this was nationwide. So it was quite an accomplishment. It made some news, and we're so proud and so honored that it came home to Ketchikan. So the journey so far is, as you can see the timeline, there's a lot of little dots here, and I could have added more, but I didn't want to bombard you, so I did do some highlights of what we've been doing so far. The grant was awarded in April of 2021, but I didn't start until August. And when I got hired, the first thing I asked, like, well, what do I do? And the Wellness Coalition, bless their hearts, are like, this is the first time we've ever had anything like this, a foundation grant of this capacity. The great part of it is that you create and figure out what you can do, but there are no policies on how to do this kind of work. So I really worked on trying to find something tangible, because I am that kind of person that I need a product. I need something to come up with to really work towards something. So I knew that October was Filipino American History Month, and I thought, well, that would be the perfect opportunity to introduce the grant, get Peace Health involved with getting some baseline information. But wow, what are we gonna do this? How are we gonna do this? Because it's still in the midst of COVID. So we did. We held our first festival at the plaza amidst all the COVID protocols, masks wearing, specific enter-exit protocols. Food had to be prepackaged. But because we were able to hold it and we had to require sign-ins, we were able to document about 600 people attending that event, even through COVID. So that opportunity to capture an actual group of individuals that represent the community that we needed to serve, we were able to get surveys done, some baseline questions. We had iPads, we had people from Peace Health walking around saying, do you have time to complete a survey and ask these answer these questions about healthcare? What are your barriers? What are your success stories? What are some health challenges? And whatnot. And so getting that baseline information was super important to then figure out how are we going to start addressing these. We had an idea of some of that baseline information already through a survey done with public health, but we wanted to see if that was still the case in 2021. One of the outcomes from the festival launched the Hats Off to Health series, which was an opportunity in January to address one of the biggest barriers that we found was healthcare insurance, lack thereof. We launched our first seminar with a collaboration with the Public Assistance Office, and I will talk more about that later. We also offered CPR training for Tagalog speakers. We had an exercise class. And then we started our research project, where we really worked with Peace Health in diving deeper into some really in-depth questions about healthcare and some of the obstacles individuals felt they could share. So we did 20 interviews, various demographics of Filipinos, ages 18 to as old as 75, addressing and asking questions like, what is your typical diet like? What did you ever experience any microaggressions when you checked in at the hospital? Are there any things that you experienced that we could work on to improve? And having this one-on-one dialogue, less of a open forum and more one-on-one, you were able to really connect and get stories that maybe people didn't want to share on a more open space, but because it is recorded and they're like, am I going to be anonymous? Yes, your identity is anonymous unless you didn't want it to be, but they did really share more. And we are working on taking all that information and creating a research project that possibly could be published through Peace Health and really others that could share that information and really trying to improve healthcare and healthcare access for Filipinos. Then it all started rolling out. We started our monthly blood pressure and insulin checks throughout the community. We had one at the plaza. We went to the rec center. We went to Alaskan Proud Market. We found various places that there were high traffic areas that we could just do these quick checks. People could check in. They could learn what's good blood pressure, what's bad, and we gave tips. We added little cooking options that could help lower and improve your insulin, and that will still continue. Then in August, we started planning our Fil-Am Fest, and we just had our second this last Saturday. So one of the reasons we come today is to figure out how the Sama-Sama Tayo project is moving along and how its impact is bringing community together. And so we feel that one of the strategies is to celebrate and elevate Filipino voices for our health through culture, community, and collaboration. Coretta Scott King says the greatness of community is most accurately measured by the compassionate actions of its members. Filipino community is very compassionate about anything that can help improve, help elevate, help showcase many talents, the things that we are proud of, and we're very, very prideful group of individuals. The top picture is a group of women over 55 that I offered an exercise class to, and I thought, how can I get different perspectives of this project that I'm getting? And I one day looked at the plaza. We had an office at the plaza, and I just saw women walking. And they were all Filipino women, and I said, hey, do you guys walk here every day? And they're like, oh no, we walk on Tuesdays because the fruit, Wolf Point Produce was downstairs and they distribute on Tuesdays at noon. So we'll do our exercise beforehand. And so I had a brilliant idea, like, well, why don't we exercise together? We'll talk about some of your health challenges, and we can, not just walk, we could work on stretches. I could teach you some weightlifting options for you to improve your bone density and things like that. And lo and behold, I offered, it was free, and they came. Our first class had 14 women over 55. We sat in a semicircle. As we were exercising, we were talking about women's health. We talked about what prevents you from going to the doctor. What are some of those barriers? Why do you want to exercise? How do you get out to exercise? And we took that data, and that was, again, another way that we brought community together. Another option we had, and I think many of you know, our Filipino community is centered in spirituality and faith, and that we have strong faith, especially in our Catholic church. So they wanted chances to celebrate many of their saints, and health is mind, body, and soul, and that spiritual health was really important to them. So we approached the Father James at the church, and they were able to really get specific Filipino saints that they wanted to honor and do tributes to. and have special days that the community could come together and really showcase that we have a strong sense of spirituality that guides many of our health choices. Many say they leave it to God, they leave it up to God, or I pray to the Lord that I'll have healthy family, and my health is a priority, but I leave that up to God. So connecting that faith-based component with this project is essential, and any, regardless if they were Catholic or not, I do feel that that was a path I had to take to really find them that common ground of, yes, your spiritual health is important, and that health also leads to physical health, and how do those connections meet? So, and we had some fun times. We had a CPR class with a group that I really tried to get more Tagalog speakers in our CPR class. We were wanting to make sure that we had bilingual CPR certified people in our community. We know that there's a high population of Filipinos that live in both Marine View and Tongass Towers. So our next outreach effort for CPR is to really make sure we have identified individuals that live in that building to be CPR certified. So while they are waiting for EMTs and everybody to come in a emergency situation, we have a bilingual speaker in the building that can help sustain life while we're waiting for emergency crews. So that was a free class that we also offered. And you have a familiar face in the corner there at the opening of our Sustaining Community and How and Why We Gather exhibit here at the museum. And I felt that that was an important component to add because that connects community, and that was the first time many people saw Filipino representation in a museum. So that was really nice. Wow, big one, celebrating culture. So many of you have attended our second annual Fil-Am Fest, which we recorded numbers, and we were at about 800. So thrilled that it is growing. We have a way that when you celebrate what you want to see more of, we need to do that. And the connection with the Fil-Am Fest to this grant was essential because when you put forth effort to celebrate something we're so proud of, people who are willing to share and to talk and to really express some of the needs. Many of us feel quiet, or they don't want to stir the pot, or they just want to be working and even killed. So any type of time that you have to maybe voice a concern, it's really hush hush. I don't want to tell anyone, it's fine. But when you celebrate culture and tell them, no, it's okay. It's okay to talk. It's okay to express. And we express in many ways. We express through our dance, we express through music and our costumes and regalia, and most importantly, our food. And our food is sweet, it's savory, it's maybe too high in sodium, but we do love it all. So finding that happy medium with culture and using culture as a way to not only get more information, our information out there to the community, but also saying, well, maybe we can prepare our food in a different manner. Maybe we can show our dances as a way of physical fitness health. So we are really trying to be creative and thinking outside the box with just not showing our culture through dance and food, but how does that connect with health, and how can we improve our health through that tie of culture and celebrating it. And lastly, we cannot do this without collaboration, without our partners, and Peace Health has been a major partner in this. They have an internal caregiver council that are employees of Peace Health that meet monthly to figure out how they can look at the systems within their own organization and feel vocal about it and feel confident about it to bring those issues to the forefront. Everything from like the interpreter services are not very user-friendly. They rely too heavily on the Wi-Fi. So if that connection is broken, you can't give or communicate with someone who does not speak English of Filipino descent. So what do you have to do is you pull somebody off the floor. You pull somebody, you know, from a different department to help translate. So language equity is a huge finding that we have identified in a system change that we can try to fix and address. Hiring people that look like us, that look like in the level of giving medical care. So Dr. Charlie Jose is a doctor and that has, as of Filipino descent, that has really, I feel, has increased the number of Filipinos who go to the doctor just because they have seen someone that looks like them, that maybe has the same experience as them, that understands them, who can speak Tagalog. So when you look at a system that is focused on, okay, internally, what can we do to make changes? Having staff inside that are working in that workforce is important. So that collaboration and the commitment that Peace Health has put forth to really allowing these wonderful caregivers the opportunity to do community outreach. These are all workers at Peace Health. They have been given, you know, time off, paid time to be in these outreach efforts. Some just do it out of like their volunteerism, as far as I just want to help our community be healthier and better. And others are just wanting to provide some basic support of, I'm just here to translate this for this individual. We come from a country that has 7,000 islands and very many dialects, and so even though we can classify ourselves as Filipino, my dialect could be different from the person sitting next to me. So knowing that and understanding that we have representation in the Peace Health arena that can accommodate that is very helpful, and we need to get that information out there. We also had a collaboration opportunity with the Division of Public Assistance. Some of these pictures are showing people from the state of Alaska's workforce who are helping with applying for Medicaid, food stamps, basic necessities that we should be offering and have the ability to offer. Some of our task force members who are part of the project served as interpreters. They serve just honestly as just a comfort level of going to an individual who asks you very detailed questions. What is your income? What's your immigration status? Things that could really be fearful for someone who maybe is not have the immigration status that is needed to get some basic services. But they came once again to our table. They came on a weekend out of the state of Alaska offices. We set up workstations for them in our plaza location. We had 4 or 5 hours of individual interviews and appointments with people who were interested in getting health insurance information, applying for food stamps, what's taking so long with their current application, and things like that. This again, out of their own time. This was not a paid event with the Division of Public Assistance. They came out knowing that this was an important outreach effort, still again in the midst of COVID. So you can see they brought their own computers because you couldn't just dial up into a network system. It had to be a state authorized computer to process these applications. And many people, they were saying they were waiting 3 to 4 months for a response because the backlog. Having someone in person is so much more valuable. And so we do feel those type of commitments to collaboration are extremely important to make a project like this successful. So coming soon. We have a National Rural Health Association conference in San Diego that we submitted an opportunity to present the Sama Sama Tayo project to this big national conference. I went to one last year in Albuquerque, And there were projects all over the nation addressing health equity and their strategies to help improve healthcare access and in communities of color. We haven't heard back yet if we were chosen as a guest speaker or presentation opportunities there, but we're hoping. If not, we will attend as attendees. But San Diego, I mean, has a huge Filipino population, and I'm thinking it might be a good a chance for us to be invited. And then locally, my next big event is a state nationwide Health Equity Summit here in Ketchikan. We will not only be presenting about our projects and our successes so far, but inviting people that I've connected with from the last Health Equity Summit that I went to in Albuquerque, but other agencies maybe that are doing similar work with different populations of color, just opportunities to learn other ways to do outreach efforts. We have a chance to connect with a storytelling project that focuses on people of color and telling their stories and their voices from their perspective, and doing video testimonies and presenting that. Hopefully this partner is able to come up and then show how we could do that on our own level, and the workshops that she can offer for other organizations that can do storytelling, but really with that focus of how do we improve health access for people who are underserved. So very, very excited. I think this would be a great opportunity for Ketchikan to be put on the map at much more than it is already, but as really a mecca of like change in our health field. Some ongoing projects is obviously we still are working on our research project with Peace Health. We have taken the data that we did with our 20 interviews, we've analyzed it, we've categorized it and find some common themes. And next is now Dr. Jose taking that and then trying to do an actual printed present publication of the findings to then hopefully get published at a much larger scale. We have our Hats Off to the Health series topics. We would love more information on mental health, the stigma of mental health, especially amongst people of color. Filipinos do not talk about mental health, and that is something that we want to bring to the forefront in a more safe and common area that maybe we could talk in a recording or not face to face and telephonically, whatever the case. We'd love to bring those topics up. We want to talk about access to healthier foods, more fun things, cooking classes with healthier options. Again, we have a high sodium and very, very sweet and savory food. So we have topics that we'd like to have at least one seminar a month as we continue. And this Hats Off to Health series with the Ketchikan Wellness Coalition is not necessarily targeted just for Sama Sama Tayo project. It can continue once this grant hopefully is over. We can continue this as a series of different events that we can offer to the community, and it is not just specific to the Filipino community. And other exciting news is that we are pursuing funding to reboot our traditional folk dance and music program in our town. When I was growing up here, I had mandatory Sunday practices to learn Filipino dance. Maybe Mayor Kiefer knows Helen LaMarche. Remember her? She was my teacher, and Grandma Clara Diaz was also my teacher. And we are finding that our elders are either passing or getting too old to continue those traditions, and we have to have a solid instructional program that can then pass these traditions on. I know maybe two in my back pocket, but I can't be the only one that has to know this information. So we are really actively pursuing funding to basically find a train the trainer program, bring someone up that can actually teach us 4 or 5. We have, I think, we have 5 genres in our dances, all representing different regions of the Philippines. So it is not just the stick dance that everybody knows. There's much more in-depth dancing that we can offer, and we're hoping that this gets funded to where we can now train younger generations and then younger generations to just learn them. So whenever we have an event, a special event that says, hey, we would love the Filipino community to come out, we could say, yeah, we have 2 dances ready to roll and ready to go. We don't need the practice because it's a ingrained cultural learned experience that we have to have. And like I said, I would go every Sunday. It wasn't just because there was an event coming, that was part of our tradition. It's like, okay, now it's time for our presentation, and so who gets picked to dance, and we would have fundraisers, and so it really is an important aspect to reboot the traditional folk dance and music of our culture. So those are some major things that are coming up, and we hope we can share more about those in the future. Okay, a test of my Tagalog here. Mas maraming ang magagawa sa pag-ibig kaysa sa takot. So, really, it says more can be done out of love than fear. Pushing that this is a love of our community and our people, I think our community then is less fearful of like, I don't want to speak up, I don't want to talk, I don't want to share my experience. Could you keep me anonymous? And I get that a lot. I get that common thing. You just talk to me. You talk to everybody. You do it. They'll pass me a note. Can you tell them this? So this project, I do hope it elevates more than just my voice. And I honestly tell people it's an honor, but it's also a burden, because if I say it wrong, if I don't get the answer they want to hear, it's on me, but it's an honor that they're giving me this chance to speak on their behalf. But I would love to hand that off to make sure that every voice is elevated, regardless of your background. But for my people, is to give them that voice to be like, it's okay, you're safe. We're doing this out of love, and people probably are experiencing the same thing as you, and you do not know that until you share your story. So that's my story. And I would love to hear from you guys, any questions you might have about the Sama-Sama Tayo project.
Well, I can start you off. We have a Facebook question of what's the best way for people to plug in and learn more about these things that are upcoming that you talked about?
Oh, wonderful question. With the Ketchikan Wellness Coalition on our website, we do have our website has been updated, and there is I think we're under Strengthening Cultural Unity Task Force, and they can definitely click on that link and they can see what other things are coming up for us. Thank you.
Alma, how do we as a museum, thinking about sustaining community and inviting, again, you were a crucial bridge in that, but continuing to tell the Filipino story, how do we help empower others to share their stories with us? Because I know it's that immense pride in that culture, again, a reluctance to share what what they've done, or just the amazing journeys. And obviously Clara was very gracious with her time, but just your ideas on how we continue to empower others to be able to share their stories.
I love that question. KPU approached me with the same question. What can we do? And every time we have an event like we did this last weekend, more people are like, oh, we need to do this again. Next year we should do this. We should do that. And I go, great ideas. These are the stories you need to tell. I remember when, I go, could you share that with somebody? So I am starting a little list of people that I would love to pass on to KPU, to the museum, to start telling our stories. We have a historian in our midst here who does document many, many of the stories. And that is where it starts, is that you make that offer, and people don't hear about that offer. But when we have cultural celebrations like this, they are more open to it now, because they see what is happening. They see that this change is coming. It's unfortunate at this point we don't have a Filipino Cultural Center specifically. We don't have a space of our own like we used to. Like I said, back when I grew up, the classes were actually held at a Filipino Community Center. We've had, I believe, 4 or 5 here in Ketchikan. All have either shut down or we sold or we moved to different locations. So currently we do not have that space, but once we do, and that's one of my big dream projects, passion projects, once we do have something like that, I find that the stories will just come naturally. You come to our table again, you ask, and I'll tell them how I got here, I'll tell them, and I also think generationally, the youth are a powerful voice. So maybe opportunities at our high school level to have chances for them to tell their stories. There is an active Fil-Am club that meets at K-High that was a real big supporter in helping plan the 2nd annual. And they have a good group of students who are working to not only promote their culture, but also to tell their stories. And I'd love for them, each of them have a different story of how they came here. Some were born here, some were immigrated when they were 12 years old. So those differences are clear on how they adapt and to assimilate and to keep their identity from the Philippines and coming here as a Filipino. And now you're in Alaska, one island to another, one tropic to rainforest. I mean, the stories are all different, but I think we have a very powerful youth voice. And then as we continue to grow our cultural celebrations, I think more people will be more willing to share stories and those opportunities, and hearing that you want to hear it is the key. It's like, we wanted more. And when I say they want more, they're like, well, who's they, right? And so when you say it, it's different. And then when you come to our table and our celebrations, they'll feel it and they'll hear it. Thank you. Any other questions? Well, thank you guys. Salamat. Thank you to the museum, and thank you for the exhibit. All the partnership is there. This is another partner that we feel is a great collaborator in our efforts. So thankful that you guys are doing this, and please be on the lookout for more stuff that we have out there in the community.